what is the best description of a split skin graft? So what I have to focus on is this, that what is a split skin graft? We know that a split skin graft is a partial thickness skin graft, which is also called as TH graft, which include the epidermis and the superficial dermis. If we take a look, this is what we have written in our notes. Partial thickness skin graft or a split skin graft or a TH graft, it is composed of epidermis and superficial dermis. Most common site from the thigh, that is the anteromedial or the anterolateral aspect. Small skin grafts, they can be expanded with the help of a measure to cover a large area. Cosmetic outcome is not as good as in a full thickness graft because a partial thickness skin graft contracts more. So for cosmetic reasons, for face area, we prefer using a full thickness graft. And when we harvest a partial thickness graft, we just put a dressing out there. How the skin graft survive at the recipient site? By plasma imbibition of the nutrients from the underlying surface in the first 48 hours. From third day onwards, angiogenesis and neovascularization starts. That means this is the knife which we are using for a partial thickness skin graft. This is called as Humbee's knife. Now we can use this Humbee's knife something like this. This is how we are going to harvest the partial thickness skin graft. Another instrument which we can use for skin grafting purpose is a dermatome. Now this is a dermatome which can be used for harvesting the skin graft, preferably the full thickness skin grafts. And this is measure. It is just like the roller on the cricket field. Just like a roller on the cricket field, you just put a mesh in this and roll it so that the graft can be expanded. So these are the various instruments which can be used for skin grafting purpose. Now, if we take a look at the options, what is about this? So you have to just find out where there is epidermis and superficial dermis. Okay, so let me screen this quickly. Epidermis, variable amount of dermal appendages. Entire dermis, no. Entire dermis, no. Entire dermis, fat and fascia, no. Basically, in the three options, he is just trying to confuse that whether we take the entire dermis or not in a partial thickness graft. And we know in a partial thickness, it is a superficial dermis which is taken and not the complete dermis. So that was the area where the MCQ people were trying to trap. Okay. So in a partial thickness skin graft, it is the superficial dermis which is taken and not the complete dermis. And in these all options, he is focusing on entire thickness of the dermis. Here underlying fat is included, here only the total dermis, here fat and fascia is included. But actually it is not the complete dermis. We just take a variable amount of the dermal appendages. That's it. So the correct answer for this would be epidermis and a variable amount of dermal appendages.